For all Americans, we must confront the rising cost of care, strengthen the doctor-patient relationship, and help people afford the insurance coverage they need. We will make wider use of electronic records and other health information technology to help control costs and reduce dangerous medical errors.
So said President Bush in his State of the Union address, receiving bipartisan applause. But what exactly is an electronic medical record, and how can it benefit the average American?
Electronic medical record, we all think of it as basically replacing paper. But really what it is a process. It's the path of taking things that we have as paper or individual data files like an X-ray film or a film jacket and making that electronic.
So that doctors have a patient's complete medical history, from past surgeries and blood tests, allergies to ultrasound exams, right at his or her fingertips. While some of our nation's hospitals and medical centers have begun transitioning to electronic records, most have not.
From a safety issue, we all focus on the most obvious benefit, which is it's better to take care of patients when you have data. If I have to take care of somebody and I don't know what their past medical history is, there's a name for that. It's called guessing. Electronic medical records really are about taking much of the guesswork out of healthcare.
At the same time, reducing reliance on faxes and phone calls, and often timely and costly duplications of exams and procedures. Doctors say we need only look to New Orleans and Hurricane Katrina to see why paper records can prove deadly. Floodwaters rendered many patients' medical histories unavailable and unreadable. With secure electronic records, patients would always have a backup. Well, many involved in healthcare agree that electronic health records can help to improve patient care and ultimately reduce the cost of that care. Initial costs remain an obstacle, and the question of who will and who should pay for the transition to electronic records is among the issues still being debated.
None of us could believe how easy it is for complete strangers to access your most private information until we saw it for ourselves. And it all has to do with your medical records now being computerized, and that's a key part of President Obama's stimulus plan.
So what we did is, in this plan, in the House bill that passed, one of the things that we do is we say, we are going to computerize our healthcare system, institute health IT.
We're also working to computerize medical records, because right now too many folks wind up taking the same test over and over and over again because their providers can access previous results. Or they have to relay their entire medical history, every medication they've taken, every surgery they've gotten, every time they see a new provider. Electronic medical records will help to put an end to all that.
Would you be able to opt out of having something like an STD or an abortion that was performed out of the records, or will it be required to be on there?
This is totally going to be up to the individual. So obviously for the full effectiveness of the person, it's to their benefit to have everything on a record, but it's going to be totally up to the individual.
Elizabeth Cohen has been hard at work at her computer.
An unusual challenge. Go online and get Gary Tuckman's health insurance records.
We're going to come back and see what you found.
I will accept the challenge. In minutes, guess what I found?
So you know that's my children's pediatrician.
I do know. I do know, because I got them all right here, Gary. I got all your insurance claims for the past 18 months for you and your entire family, and all you gave me was your date of birth and your social security number. That was it.
There's no security in place, no enforcement in place. Who's going to do the data entry? Who's going to make sure these medical records are secure? And all you actors and famous people out there, you think you're going to go to a hospital and just because you're famous or you're some actor, that your personal health information is going to be secure? It's not.